Thanks, Sean, and thank you to the university for inviting me here to share some of my work. I'm trying to open this laptop. Oh, it's locked. You know, now that since we have a couple of minutes while we're setting up, I'd be curious to see how many people here come from the health sector. Fair number. Planning? A lot. Great. Architecture? Fantastic. Economic development? Terrific. Commercial sector? Great. Fantastic. Other? Okay, terrific. So we've got actually a great mix of people here. And I think that that is really the start of what we need to do in our communities. If we're working together, that's our best hope, actually, at finding the solutions. So I'm going to actually talk about some of the things that have had cross-disciplinary involvement and the successes that were able to be achieved through those types of involvement. So I'm actually a physician by training, and you know, you might be asking, what does a physician have to do with community building? Shouldn't I be in a clinic or in a hospital? Well, I'm in a clinic or in a hospital when actually our communities fail to prevent the problems that are very preventable. Then I need to actually treat those problems, right? But early on in my career, I decided, you know, I wanted to do public health because we could actually prevent a lot of these problems. And when we don't prevent them, not only do we have human suffering and premature deaths, but we actually it also entails really high costs for us as communities. So we're going to talk about that. So, you know, the health side is not unlinked, actually, to all of the economics that we've been hearing about this morning. So in certain of our states in the US, like Arkansas, for example, obesity and diabetes and the costs related to healthcare for small businesses have become a leading cause of small business bankruptcies in our communities. So they're actually not unlinked, and they're tied together. So I'm going to talk about active design for healthy communities. Designing our communities to be healthy through planning, transportation, architecture, and thinking about, I think, what our current epidemics are and that we need to address. So I'm going to start also with a little bit of public health history, right? In the 19th century, our leading causes of death were different from our causes of death today. They were the infectious diseases like cholera, yellow fever, tuberculosis. Those were the leading killers, right? And what did we do to actually defeat them? We didn't have antibiotics in the day. We didn't have many of our vaccines in the day. So what we actually had to do was to look at our cities and our city infrastructure. And planning and public health actually were birthed together out of these issues of infectious diseases and the epidemics that we had to solve. So we actually created sanitation systems, clean water systems, sewer systems. We designed our buildings to have good ventilation, to have light and air be able to enter through windows by building codes. We used zoning to address setbacks and streetscapes. And what did we do? We actually were able to defeat many of these diseases by the mid and early 20th century. And this was actually, many of our cities defeated these epidemics even before we had antibiotics. So, you know, the first antibiotic, penicillin, not discovered until 1939. And by 1939, 1940, many of our cities actually had these infectious disease epidemics under control already. Now, those antibiotics, of course, continue to be important because when you get sick, you still need to be treated. The story is, if we can prevent these diseases in the first place, that's actually the best way to go. That's how we actually create health in our communities. And health actually translates into wealth, as we're hearing. In the 21st century, we've got a different set of diseases, chronic diseases. We've done a great job at defeating these infectious diseases. Our public health departments continue to, work avidly at these issues, important. But we also need to, in health and around us in other sectors, think about the current epidemics that are occurring today: heart disease and strokes, diabetes, cancers, and they share actually common risk factors, as I'm going to show you. But they also actually fundamentally share some of the other issues that we're concerned with, right? We've heard about the economic issues. Environmental issues is also another issue that many of our communities are trying to improve. And many of our chronic diseases we can actually think of as diseases of energy. Why? Obesity, for example, diabetes, they are shaped by physical inactivity, and when we don't move our own bodies, what do we need to do? We use some sort of external energy source to move us, whether it's petrochemical fuels and cars, or elevators and escalators that use electricity. If we're not playing actively with our kids in leisure time, they're in front of the TV, utilizing energy. If it's in the summertime, air conditioning is also on full blast while they're watching TV. And these have implications for our environments as well as our individual health. When we overconsume unhealthy calories, we're overconsuming energy also. So actually, the solutions around active design actually very much also parallel and overlap with what we need to do to improve our community environments for greening and environmental sustainability. And so if we're going to do this, we have to do this together, just as we did that together for infectious diseases. So our sanitation systems, our water systems, our sewer systems, they're not run by the healthcare system, right? They're run by other sectors in our community, and they've been successful. And so similarly, if we're going to actually create healthy communities, we can't rely on our hospital sectors and our clinic sectors for treatment. That's the end result of not having healthy communities. So how do we create healthy communities? Well, if you look at our built environment today, this term obesogenic, right, has been used to describe the environments that we live in. You live in them, you can't really move around very much, so you don't burn the calories that you need to. Unhealthy, high-calorie foods are everywhere, whereas, healthy produce may not be even available in some neighborhoods. And so just by living in them, you're actually going to gain weight. We know that actually people want those healthy behaviors. If you look at the top New Year's resolutions, right, what are people trying to do? They want to quit smoking, they want to eat better, exercise more, lose weight, drink less. So these healthy behaviors that we talk about education, we actually know our education has been working in the sense that it's making people motivated, they want to do it, right? But why are they failing? They're failing in large part because our environments don't actually support those behavior changes that day in and day out they're trying to make. And everyone has busy lives, so when something is very difficult to do over time, by the end of January, many people throw up their hands and they're saying, oh, I think I can't even face trying again for another year. So the question becomes, how do our communities help people become successful in the choices we know they want to make? So the epidemics of today, as I said, chronic conditions, chronic diseases, obesity, diabetes, heart disease and strokes, cancers. In fact, even in the developing world, these diseases have overtaken infectious diseases as the leading causes of death. 36 million deaths per year, 80% preventable by addressing 4 major risk factors. Physical inactivity, unhealthy diets, as I said, also linked to this energy equation that many of us in our communities are facing. Some of you may have seen these maps. Obesity maps in the United States, generated by the US Centers for Disease Control and Prevention. This is where actually my work around the built environment began, about nearly 15 years ago when I was at CDC doing work for them with state health departments around addressing the built environments to improve obesity, physical activity, and healthy eating issues. So when you look at these maps, keep in mind that these are actually an underrepresentation of the obesity problem in the United States because they're based on surveys, right? So across the US, across states now, we've got surveys that are undertaken every year that ask people about their health. Do you have diabetes? Do you have hypertension or high blood pressure diagnosed by a doctor? What is your height and weight? And these heights and weights are used to calculate something called body mass index. A BMI of 30 or above, which is the ratio of your weight to height, is used to determine if you are overweight or obese. And these trends are used to monitor how our population is doing over time in their health status. So when you ask people, right, about their weights and heights, a pattern emerges, right? Women tend to underreport their weights. Men tend to overreport their heights. So these ratios that you're going to see of weights to heights are actually an underrepresentation of the true problem. The true prevalence of obesity is even higher than what we're seeing. So in 1990, when states began collecting this data, you will see there's no state above 14% obesity rates. 5 years later, this map has completely changed. You know, half the states are at 15 to 19% obesity. 5 years later, the map completely changes again. Over half the states now above 20%. Colorado is trying to hold on to the 10 to 14% mark. It's not successful. It transitions to the 15 to 19%, while the rest of the US transitions by 2005 to, you know, the majority of states, all the states, practically all the states above 20%, increasing number of states above 25%, states above 30. By 2010, no blue left on this map. Right? And this is why, I think if you've read in the media, you've heard about it, obesity is considered an epidemic. It's risen, this is an adult map, and the rates in children have risen even more rapidly than in adults. And you know, some people have predicted that we might see a generation of children whose life expectancies for the first time will be lower than their parents. You know, when I was going to medical school, type 2 diabetes was actually called adult onset diabetes because you rarely saw it in people under the age of 50, 50, right? And the complications of type 2 diabetes are kidney failure, needing transplants and dialysis. It's a leading cause of blindness because it affects the blood vessels in the eyes. It's heart disease and strokes result from it. Limb amputations because it affects the blood vessels and the nerves in your extremities. Now today, we don't call it adult onset diabetes anymore. We call it type 2 diabetes. Why? Because you're seeing younger and younger people have type 2 diabetes. You go to talk to any pediatrician and they'll tell you they've got routinely teenagers who show up with type 2 diabetes, even young children, because of the obesity epidemic. So we're not talking only about healthcare costs here. We're talking about, well, we have a workforce. What about issues of disability in our workforce as younger and younger people are diagnosed? So, you know, if you got diabetes when you were 55 or 60 in the past, you would develop your complications in your 60s, in your 70s, in your 80s. But now, if you're getting diabetes, type 2 diabetes, at the age of 10, when are you going to develop your complications? In the prime years of your adult working life. And so this is the situation that we're facing. And costs are astronomical. So in the US, the CDC estimates we're spending about $150 billion today. If we don't reverse the trends, we're going to reach nearly $1 trillion of healthcare spending by 2030. 86% of our adult population will be overweight or obese if the trends continue. So what can we do? Well, we're lucky in that alongside these problems that we've been seeing, research has also been accumulating on what we can do. So we can use the evidence from research to help us address the types of things that we have to address to make a difference. And the evidence is growing, and in many cases now sufficient and strong, that we can actually improve these health parameters by improving our buildings, our streets, and neighborhood designs. So we know people, through their New Year's resolutions, want to exercise more. They want to be more active. They want to eat better. They want to lose this weight. And by creating better buildings, better streets, and better neighborhoods, we can help them do that. So designing for active transportation, really important. Sufficient evidence that when we create walkable neighborhoods, neighborhoods that are sufficiently dense to support mixed land use, connected by pedestrian paths, sidewalks, bike lanes, that are along these routes also aesthetically pleasing and safe for people to use, that can increase people's physical activity 35 to 160%. This is regular physical activity. And this is across all of the studies that have been done out there that have been synthesized by a task force called Community Preventive Services Task Force, which was assembled by the US Department of Health and Human Services. We can design so that, you know, in addition to active transportation, walking to work where it's feasible, walking to do errands, walking your children to school, that in addition to that, transit's important, and in leisure time, we can also design for active recreation. So when people actually have parks and playgrounds in their neighborhoods, near where they live, work, go to school, that increases leisure time activity and is associated with lower weights as well. That's strong evidence for that. Even in our buildings, we have the opportunity to design back to, I think, some of our great buildings of the past. So in the past, you know, you walk into a building, they were human scale, so, you know, they would run from 2 to 6 stories, so it was actually walkable within our buildings. You would walk on the streets, then walk into our buildings, walk up the stairs. You know, of course we need elevators for people who have disabilities, who are carrying huge, heavy loads. But in fact, you know, if we were able to design our buildings to encourage people who had the ability to walk the stairs to do so, not only would we improve their health, but as we heard when I was working with the Mayor's Office of People with Disabilities in New York City, people who have disabilities would be able to use those elevators better, because very crowded elevators that actually stop at every single floor are difficult to use for people in wheelchairs who might have walkers. So we can actually synergize multiple impacts and impact quality of life for everyone. And simple things, you know, if you put a point of decision sign, like, you know, in New York, we've got these signs called burn calories, not electricity, take the stairs, right? And it's on a green sign with, you know, a little stick figure walking up the stairs. It's been actually adopted for use in London, England, in, you know, certain other cities that have asked permissions to use that sign. That posting signs like this across many studies that have been done will increase stair use on average 50%. So if you post them next to the elevator call button, if you post them outside of stairwells. So very simple, inexpensive interventions can actually make a huge difference. And you might ask, oh, you know, what can a little bit of stair walking do? Well, you know, Harvard actually did an alumni study of over 10,000 of its Harvard alumni men, and they found that, they followed them over a 13-year period, and they found that the men who climbed on average 20 to 34 floors of stairs per week. So that's only, you know, 3 to 5 floors a day if you divide that by 7. They had an average 29% reduction in their risk of stroke, okay? Calculations done on caloric burn show that if the average American adult was to climb just 2 minutes of stairs per day, we could offset those average weight gains that you're seeing on those maps. So these simple things done in everyday life, frequently, routinely, are actually really important. It's also important to think about our food environments because, you know, there are now studies showing that if you have supermarket availability of healthy, fresh produce compared to fast food restaurants, that if you have too many fast food restaurants, that's associated with higher weights and less healthy eating in children and adults. If you have access to fresh produce in an affordable manner, example via like supermarket development in some of our food desert areas, you can actually increase healthy eating and lower weights. Community gardening, you know, that may not at the current time be our solution to providing healthy food everywhere, but exposure to community gardening, there are some studies showing that adults and children exposed eat more fruits and vegetables, and even access to tap water, right? Healthy, sustainable, inexpensive in terms of equity issues. There are now studies, for example, in German schools, they actually made tap water an accessible thing by ensuring that the water fountains were working. And when they followed these schools compared to non-intervention schools over time, over a period of some years, they found that in the intervention schools, after a period of some years, they had lower rates of childhood obesity compared to the schools where they did nothing. So, you know, in New York, so prior to my becoming a consultant working with multiple cities, I was recruited up from the Centers for Disease Control and Prevention to New York City in 2006 by the health department because they wanted to start a healthy built environment program. And so I was their inaugural built environment and active design director in New York City for over 8 years. And I ran their program that really worked by partnering, reaching out to and then partnering with multiple sectors, including our communities and community residents, to make the types of differences that we see. So one of the first things that New York did was, in addition to bringing people together in conferences like this, through our Fit City conference, to generate ideas, one of the ideas that came up was we should actually take this health evidence and put it into a format that planners and architects and developers and facility managers can use. Because planners and architects were telling us we don't necessarily read the health literature or health research articles, and it would be really helpful if you could synthesize this. And so we worked across 12 city agencies: health, public works, transport, planning, housing, parks, management and Office of Management and Budget, Sustainability Office, Mayor's Office of People with Disabilities, as just some of them, aging, to create these set of active design guidelines that highlights simple strategies in the urban realm, in the building realm, and also synergies that could be achieved by doing this work. So urban design strategies, I think the group knows, we've heard a lot about them. Land use makes sufficient densities to allow for those, and thinking about healthy food and active recreation areas as part of that land use mix. Certainly transit access, pedestrian-friendly environments, and bicycle networks and infrastructure, and thinking about building design that complements that, right? So if people are going to ride their bicycles when they get to their job, they need a place to park those bicycles and to make sure that they're not going to have to worry that that bike's going to get stolen, right? We have a lot of multi-residential buildings, and so it was really important, multi-residential buildings, that those sites, particularly neighborhoods that may not have enough parks or playground amenities, that those amenities could be incorporated right into the community spaces within those buildings. And then, of course, even simple things like stair promoting strategies. In very high-rise buildings, you can even program your elevator to be skip stops. So, one ADA elevator and all the rest of them become express elevators, right? That stop at every third or fourth floor, making you traverse a few floors every day by walking the stairs. What else can be done? So in addition to taking the evidence, putting the evidence in usable format, we can find synergies, right? We've heard a lot about the synergies today with economics. Certainly improving the environment is another synergy that we can have by doing these types of interventions. We usually typically think about walking, cycling, taking transit as the environmental synergy, but did you know that an escalator running 24/7 can generate something like 4 carloads of carbon dioxide into the environment each year? TVs in New York State, very soon going to overtake refrigerators as the main source of household appliance energy use. And we know that when people are sitting around watching televisions with their air conditioning on full blast on those hot summer days, that's one of the reasons we get the blackouts that we do in some of our cities. So how do we synergize and work across sectors to get these multiple outcomes? We think about tap water very frequently, and it's opposed to bottled water, but all those soda pops, the cans and bottles are going into the landfill. They have huge transportation miles. And when you eat fresh produce, it leaves very little waste. But all of those packages of cookies and chips or fast food wrappers, they're going into the landfill. And of course, landfill, somebody's got to collect that garbage, somebody's got to house that garbage, so that's also associated with additional economic costs. Creating more accessible places for everyone. So I talked about the elevator example, freeing up the elevator for people who actually need them when able-bodied people are walking a few flights of stairs every day for their health and for other reasons. But we also have an aging population, and the most walkable urban realms, if they house our seniors, this is where you can age in place, right? When you stop driving, you can actually walk to visit your friends. You can walk to the neighborhood grocery store. You can walk to the neighborhood park. Prevents isolation. I did a study in Taipei, Taiwan, and it's incredible, but they have a lot of neighborhood parks, and they put in exercise equipment for their seniors. And in the big parks, they've got like informal exercise classes that are run by other seniors. And it was amazing. From 4:30 a.m. to 10 a.m. every morning, those parks would be swarmed by seniors. And because parks were being utilized by the seniors, including in the high-needs neighborhoods, those parks became really safe. There was no drug dealing at 4:30 in the morning because, you know, all of these seniors, thousands of them, would flock to these parks while it was still dark. And then the COS issues, which, you know, other speakers here have been speaking about. So studies now showing that more compact, walkable patterns have lower infrastructure costs to develop and maintain over time than sprawl scenarios. Equity issues, like, for example, where you live determines how much cost you have to spend out of pocket on transportation every month. If you're in a completely car-dependent neighborhood, you can spend as much as 25% of your income. Whereas if you're living in a neighborhood where you have options, you might spend as little as 9%. And so if you don't have very much money in your pocket, that matters a lot. And finally, and most importantly, using all of this information, but partnering across sectors to make this happen. So this is an example of a conference like that in a place like New York. For the 8 years that I was Built Environment and Active Design Director, we had an annual Fit City conference, and it continues today. I'm not running it anymore, but we would bring together different agency heads. So, you know, we'd have like 10, 12 different commissioners on a public sector panel talking about the successes of the last year and what they intend to do in the upcoming year. We would have a private sector panel that would highlight our best developers, our commercial and business partners that made a difference in their communities. We would have a community sector panel that talked about what community residents and what community advocacy groups were also doing in their own neighborhoods to make change, to create healthier communities. And this conference, I'm happy to report, I've had the privilege of actually helping cities around the world to mount these conferences, from London to Sao Paulo, to New South Wales and Australia, cities in the US as well, like Miami and Boston. In Canada, where I actually originally hail from, I grew up in Edmonton, Alberta, Canada, north of Montana. And I've been asked back now by many communities there to work with them also to create initiatives and help to foster and accelerate initiatives that could create healthier communities built on active transportation issues and active recreation, healthy food access. And, you know, in the US, I've had the privilege of working with many communities as well. And what I want to demonstrate with this slide is the communities that are doing this kind of work, just like right here, you know, they're not only large cities, they're suburban communities like Cook County and around Chicago. They're small tribal nations like Cherokee Nation. So of course the scale of the work might be different, but this is to say it's feasible in different communities. So what can you accomplish when you partner across sectors and find synergies? Well, here are some examples of successes. So I'm going to give you a few New York City examples. In New York, when I was a director of the health department, I partnered with our public works department, US Green Buildings Council, architecture firm, lead consultants, and developers to actually create a new pilot credit called Design for Active Occupants for the LEED Green Building Rating System. I've also worked with enterprise green communities, and you know, in their upcoming rating system, you're going to see more health element being integrated, right? So what started as one project, right, to improve LEED certification, LEED green building certification, and including health as a very explicit parameter in one clinic run by the health department, that's what we did to create the credit. And then we disseminated it with the help of US Green Buildings Council. There's now over 250 buildings in and outside New York that are now using this credit. So don't ever underestimate starting small and then disseminating. We can address active living and safety at the same time. So the partnership of Johns Hopkins University, Society of Public Health Education, and multiple departments in the city created this document called Promoting Safety that looks at, if you did active living strategies, could you also concomitantly promote safety? And of course we found many of the strategies overlap. So if you want to create safer communities, you can do that. Both crime and traffic safety using active living strategies also. You know, one of the things that then came up from a lot of affordable housing developers was concern, and affordable housing authorities, that, you know, they thought that some of the strategies in the active design guidelines would be great to incorporate into social housing. but concerns that we wouldn't be able to afford that because, aren't these strategies expensive? Well, just like in the public realm that I talked about earlier, studies showing that when we design our communities better to be more walkable and more compact, we're actually saving money. Well, in the affordable housing sphere, you can actually integrate in strategies from the active design guidelines because many of them are actually inexpensive. For example, we have to have stairwells in our building for fire safety. And so where you put the stairwell doesn't have to cost you more. It could be more prominently located, or it could be located in the back of the building where you can't find it. You can paint your stairwell a different color than the usual gray or dull colored paint that says don't use the space. You can use vibrant colors, and the colored paints don't cost more than the gray colored paint. So very inexpensive things can be done. And this was done in partnership with developers in San Antonio, in Atlanta, and in New York. And so it's been vetted. And they were the ones telling us, you know what? Okay, it's great you've costed out these things, but we'll also help you identify the things that we could do right now. And we're going to start doing them. And so some of the developer partners have already said, going forward, the social housing and the affordable housing we build is going to include these strategies. You can improve sidewalk design. So this was done, New York City Health Department, when I was there working with transport and planning departments, and our city planning department actually led the study. We had a mentoring grant actually to work with multiple cities across the US on these issues as well. So our planning department took that opportunity to partner with a number of them to go and look at best practice sidewalks in these communities. And then they actually created these couple of documents for use both in New York and elsewhere. We can program public spaces so that they become better spaces. So, I know you have an open streets here in New York. We've got summer streets in August. We've partnered, when I was, at the health department, we partnered with the transport department to do a study, and we were able to show that people who came out there were getting half of their weekly recommendations for physical activity met at the summer streets route, right? And about a quarter of these people were folks that didn't actually get enough physical activity in their daily life. But we were also able to show, by showing which zip codes were coming out to that summer streets, because it was in Manhattan on Park Avenue, 7 miles of it, we were able to show that our underserved neighborhoods in the outer boroughs were not making it out there. So using that data, we've now worked with transportation to create place streets, which are single blocks of neighborhood streets that are closed in all 5 boroughs, that are run by community groups or schools to create more spaces for families to play actively and for people to gather. And in terms of this work, we can also be improving equity issues, right? Unequal and inequitable neighborhood environments are a major source of inequities that we find in health and in opportunities. So, if you need to have a car in order to get to your job, right? That means that you have less access to the jobs that are out there, right? If you need a car to get to healthy food, it means that you may not ever be able to buy healthy food for your family. And so you're going to go to that neighborhood bodega and buy what's there, which is soda pops, chips, alcohol, cigarettes. So anyways, what has all of this done? Well, I'll give you an example of the types of evaluations we've done in New York. We've shown, of course, pedestrian volumes increasing at pedestrianized areas, so that's more walking. That's good for health. Stair use, where stair prompts and stair interventions have been done across our partner sites. Bicycle commuting up nearly 300%. Transit ridership through bus rapid transit routes that have been created to areas underserved by the subway. We've increased bus and transit ridership, even though transit ridership was high in New York. Many, many new places now for families and children to play and for people to gather and meet each other. Traffic fatalities down 30%. We've started reversing childhood obesity. Life expectancy in New York City, 2.2 years longer than the rest of the US and rising faster than the rest of the US. US adults, New York City adults have tripled the rates of measured physical activity, most of it through walking and cycling in daily life. And here are some of the additional synergies. This is Times Square, the most famous pedestrian plaza. You could see Plant potters, paint, and street furniture, not expensive to actually create this plaza. And pedestrian volumes are up, injuries, not only to pedestrians, but to motorists are down. Air pollution is down, and retail sales are up. In fact, for the first time, Times Square is in the top 10 retail areas now in the world. And this is not just in Times Square. Our Department of Transportation, who actually manages the Public Plazas program in New York, they've actually done a whole host of case studies looking at pre-post outcomes from things that have been done in Brooklyn and the Bronx, in different areas in Manhattan, so not just Times Square, and they've shown these types of synergistic impacts. You see decreased speeding, decreased injuries, increased, of course, pedestrians and cyclists, but lower retail vacancy rates, increased retail sales. For example, in Brooklyn, 172% by taking this underutilized parking area and creating a pedestrian plaza. So I want to thank everyone who have contributed, I think, contributed content somehow to my work. Just to give you a heads up, there is an American Planning Association is having an international webinar that myself and the co-lead authors of the Active Design Guidelines are going to be having this Thursday morning at 9 to 10:30 a.m. Eastern. So please join us if you can. I'm teaching a course, actually, in New York City. It's a practitioner course. It's meant to be intersectoral and multidisciplinary, June 1st to 5th in New York City. So if you want to come and spend a week with us in New York, please register. And then I would want to stop by asking you to think about what are the top 2 opportunities you can do right now to create health, as well as all of these other outcomes in your own community. And what's the one thing you can do when you leave this conference to get the ball rolling? I've had the opportunity to work with over 40 communities globally, and if your community isn't doing it, you need to join us. You need to join all the communities doing it, because we now live in a globalized world. And to be a competitive city where people want to live, where businesses want to locate, and where people can be healthy and happy, this is what's needed to be done. So thank you very much.